everyone. This lecture will cover Part B of Principles of Anaerobic Exercise Prescription, and we are going to talk about considerations for exercise selection. In Part A, we discussed needs analysis, so now we're on to number 2, which is exercise selection. So how do we know how to select the appropriate exercises for our client? Number 3 to 7, we're going to cover in class during an in-class lecture. There are 6 main things you need to consider when we're selecting exercises. The first is the movement and muscular requirements of your client's lifestyle, occupation, or sport. Okay, so it comes back down to your needs or demand analysis to see what movements and what muscular requirements are required. Number B is your client's exercise technique experience. So you want to classify your resistance training status of your client. Number 3 is the goal of the training program will really dictate which exercises you want to select, the equipment available, the amount of training time you have available with your client, whether you're meeting them once, twice, 3, 4 times a week, 5 times, whatever it may be. The time is very important to dictating what exercises you select. And then lastly, specific for athletes is the time of the season. So you need to know which time in their year training plan they're in. Are they in the competitive season? Are they pre-season, or are they in their transition phase? Once we have considered all of these elements, we can then pick the most appropriate exercises that will get the most out of the training. There are 5 different exercise types. The first one we're going to talk about is called core exercises. And these are the exercises that recruit one or more large muscle groups. So as you can see here, there's the deadlift. We're recruiting a lot more than one large muscle group, and it's involving multiple joints. So this involves 2 or more primary joints. As well, they typically receive the priority because of their direct application to tasks of everyday life, as well as to sport performance. So you typically use core exercises as the basis for exercise prescription. The second type of exercise is assisted exercises, and these recruit smaller muscle groups. They usually involve only one primary joint, and as you can see in the pictures, they're typically machine-based exercises that isolate one specific muscle group, and they are considered less important to improving functional ability of your client as well as sport performance, because obviously you're never lying on your stomach doing a calf raise in a sport. So they're not really sport specific. You would more go towards a core exercise instead of an assisted exercise if you're looking to develop a specific muscle movement pattern that's related to functional ability in a sport. These are useful for maintaining a balance between agonist and antagonist muscle groups, especially if the occupation or sport places an uneven demand on the body. An example of this would be the sport of tennis, where one arm is being exercised the entire time. You have your racket hand. And the other arm, if you notice, the forearms of most professional tennis players are very small on the arm that they're not using, while it's very large on the arm that's constantly holding the racket and being used. And so you may want to develop some muscular balance. And so assistant exercises would help in maintaining a balance between the agonist and antagonist muscle groups. Here are some examples of core and assistant exercises specific to athlete movements, or even for any client's movements. For kicking, some kicking movements to strengthen the muscles of kicking would be an assistant exercise known as leg extensions. There's also hip abduction as well as adduction. For jumping, you could use power cleans, calf presses, or jump squats. Rowing are seated rows, hip sleds, single arm rows. All of these are more sports specific and are specific to those movement patterns. So ideally, you want to pick exercises that mimic as closely as possible the demands that are placed on the client in their daily life, in their occupation, and in their sport. If we look at swimming, specifically the front crawl utilizes the latissimus dorsi a lot for the pull phase. And so you would want to do lat pull downs, pull-ups, lateral raises, overhead pulls, anything that utilizes that large muscle group of the lats to strengthen it. And hopefully the strengthening of the lats through resistance training translates into a greater force production in pulling water in the pool for the front crawl, leading to a performance enhancement. Okay, for sprinting, lunges, step ups, and calf raises, and then throwing, overhead pullovers, tricep extensions, internal and external shoulder rotations. And this will hopefully help target those three main goals of program design, which is injury prevention, building system tolerance and capacity, and lastly, improve performance. Remember, you want to be as specific as possible to drive the underpinning physiological adaptations that you're hoping to achieve. So in picking exercises, you want to pick ones that are most specific to getting the desired outcome. The next type of exercise is structural and power exercises. So structural exercises are those that load the spine directly or indirectly. As a squat loads the spine as the weight is on the shoulders, and or a deadlift indirectly loads the spine. So these are typically multi-joint core exercises that places axial stress or load either directly or indirectly on the spine. And it really requires the torso to maintain an erect or near erect posture, so a nice straight posture. So two prime examples are a squat, which directly loads the spine, and a deadlift that indirectly loads the spine. Both of these are core exercises and both are multi-joint. Power exercise is a structural exercise. So it's an exercise that loads directly or indirectly the spine. It's a core exercise, but the key here is that the difference between a structural exercise and a power exercise is that the power exercise is done very quickly or explosively. You're trying to do the movement as quickly as possible. You want to ensure that the exercises you choose are specific to the adaptations you want. Okay, so for example, in a sport, you want very sport-specific exercises. And this comes back to your needs and demand analysis, where you look at the specific movement patterns of the sport, and then you pick exercises, core and assistant exercises, that will help translate into performance improvements or reduce the risk of injury and build system capacity and tolerance. So the more similar the training activity is to the actual sport movement or the occupational movement, the greater the likelihood that there will be a positive transfer to that sport. And it comes down to the SAID principle, which we talked about in class, specific adaptation to impose demands. You will get a specific adaptation to whatever exercises you pick. So you want to be as specific as possible to what you want to accomplish and what you want to achieve for that person. Here's a table showing some examples of movement-related resistance training exercises. And the evidence is really not convincing in regards to the impact of resistance training on performance in a sport. So we don't really know how much resistance training improves sport performance, but we're hoping that we have a positive translation of the gains that you get in resistance training to performance. And really, I want you to remember the goals of training. One is injury prevention. So you're building strength within those areas that injury could happen. So that's key. Number two is you are building system tolerance and capacity so that the individual is more efficient at performing the movement patterns. And then lastly, you're hoping for a translation to improve performance. So now let's look at some of these examples. Let's look at the movement patterns. So ball dribbling and passing. So related exercises are close grip bench press, dumbbell bench press, tricep pull down, and reverse curl or a hammer curl. Okay, so those are more specific as possible to ball dribbling and passing to strengthen the muscles that are related to that movement in the sport. So now let's go down the list and look at running and sprinting. So it's considered that a snatch, a clean, a front squat, a forward step lunge, a step up, all of these are core exercises. They are multi-joint and they recruit one or more large muscle groups. And then there are more assistant exercises, leg extension, leg or knee curl, and toe raises, a dorsiflexion, which all are considered to help in improving and strengthening the muscles that are related to sprint performance. Okay, so ultimately you're trying to build reduce the risk of injury by strengthening the tendons, ligaments, and muscles that support the joint, and then also build the system tolerance and capacity to running or sprinting, hopefully translating into a better performance when you're on the track. So there's a few other considerations for exercise selection. The first one is muscle balance, so the balance across muscle groups. So just for definition purposes, the agonist is the muscle or muscle group actively causing the movement, and the antagonist is the sometimes passive muscle or muscle group located on the opposite side of the limb. So how much balance is necessary? Well, we can consider a tennis player who has a huge difference in muscle mass between their dominant hand, their racket hand, and their non-dominant or non-racket hand. And then we also look at a baseball pitcher who uses one arm to throw the ball. Well, that one arm has a high amount of flexibility, maybe a lack of strength for more flexibility in getting the movement pattern proper, but how much balance is necessary? And this is really dependent on the athlete, their sport, the occupation, the physical demands of the individual. And so you want to develop some muscle balance, but it really is dependent on sport specificity and occupational specificity. The second component is selecting exercises to promote recovery. And you do not involve high muscular stress or high stress on the nervous system. So these are movements that promote movement and restoration. And how do you do this? Well, it's possibly allowing the individual to pick movements that they feel help in accelerating recovery, helping them feel recovered, and helping their muscles feel more limber and more recovered after hard exercise. There are three other considerations. One is exercise technique experience. You really don't want to assume that your client will perform an exercise correctly. Whether it's an elderly person or a high performance athlete, you can't assume that they have proper form. And so if you're ever in doubt, and I always do this before I start with someone and before they actually start the program and I hand over the program to them, I ensure that my client demonstrates the exercise. I demonstrate it, they demonstrate it, and I see that they're proficient in the movement patterns. That's key because one of the goals of the training program is injury prevention. You don't want to cause injuries by prescribing exercises that the person can't do properly. So it's very important that you look at their movement patterns while they're doing the exercise and provide the instruction as needed. And we'll talk about this on the next slide as well. You'll have an entire lab associated with progression, regression, and we'll just leave this for the next slide. Another consideration is the availability of resistance training equipment, whether you're prescribing a program that's facility-based versus field-based. They may not have access to a gym. And so you may prescribe exercises that are done in a field, and they just do pull-ups from a tree, or they do lunges across a field, or they do sprints from across the field, or they're doing plyometrics. So you have to assess the availability of resistance training equipment and be flexible and be able to prescribe exercises based on not having equipment. And then also you have to consider the travel. So this is especially true for occupations which cause your client to possibly travel where there may not be access to a gym facility, or athletes in their final prep before World Championships. They fly somewhere for World Championships and they don't have access to a gym. So how do you maintain strength during that time? And so you need to be adaptable and maybe prescribe bands and different modalities of resistance training to ensure that they are getting what they need to feel strong and keep up with their training plan. And lastly, you want to determine the available training time per session. How long do you have with the person? If you only have a half an hour, you really want to prioritize time-efficient exercises when you are limited and from a time perspective. Okay, so you want to pick the most effective movements. Typically, these are core exercises. You would move away from any assistant exercises if you're crunched for time, and do prioritize the core exercises, which are multi-joint, as well as recruit two or more large muscle groups. This is a fantastic chart, which if you're ever going to train anyone in a physio clinic, in chiro, in any occupation, you really want to take hold of this chart. And this is exercise selection based on technique and experience, and it's a progression regression chart. So if we look at the standard movement, so let's look at the top movement, which is squat, and we go over to the fourth column, which is the standard movement, which is a back squat. So you get your client to demonstrate a back squat. If you see that their movement of the back squat is not very good, then you regress them. So you regress them, first of all, to a wall sit and see that they can do a wall sit, that they're not showing knock knees, and they're able to hold the form of a wall sit. And then you can progress them to a dumbbell squat. Once they've done a dumbbell squat proficiently, then you move to a back squat. Once you see that that movement pattern is good, then you prescribe the back squat. If you want to progress them further, they can then do a front squat. And then eventually, if they're proficient in that movement pattern, then you can progress them to an overhead squat. So as you can see, if your client is lacking in certain movement patterns, you can progress or regress and then progress them accordingly. And these exercises that are within each of these rows target the primary muscle groups that you're targeting, but do it in a way that you're not compromising the movement efficiency. And that's so important. And you're going to be having a lab with Jeff Watson from ETS talking specifically about progression and regression. And I really want to make this a priority because this chart will really help when you're assessing movement patterns and knowing where to start the individual and how quickly to progress them and or regress depending on the efficiency of movement. Because remember, going back to the goals of a program design, you want to prevent injuries and you want to build that system tolerance and capacity within the movement patterns for that individual. And so you can only do that if the person is moving properly. And so you want to ensure that you're not causing injuries by them having improper and inefficient movements. So in summary, there are two major types of exercises, core and assistance. You want to pick core and assistance, structural and power exercises that most closely mimic the demands of the lifestyle, occupation, or sport to try to increase the transferability to enhance their performance in their sport, in their profession, as occupation, and or their life. As well as you want to build that system tolerance and capacity and prevent injuries. There's multiple other considerations for exercise selection, such as muscle balance and other ones we talked about. And exercise selection and progression should be based on the athlete's experience and technique with core exercises. So you really want to apply the principle of progression and regression depending on the movement and the movement quality of your client. And lastly, just a reminder to do your quiz 5 for this week.